Committee of the Whole is back in order. Senator Sabrina Salas Montanani, you recognize.
Thank you, Mr. Chair. Mr. Chair, I move that Bill number 18638 COR as amended by the Committee on Finance and Government Operations enact to appropriate the unallotted balance of the Pharmaceutical Fund of the Guam Memorial Hospital Authority with the recommendation of the Committee of the Whole to be placed in the third reading file.
Objection.
There's been an objection. All those in favor of placing Bill 186 in the third reading file as moved by the author? Sean. 2, 3, 4, 5, 6. Motion carries. Senators, we are now in recess in order to bring in the panel on the next bill. We stand in recess. The Committee of the Whole is back in order. I just wanted to make sure we let the viewing audience know this delay is not on the legislature. We're actually waiting for the Department of Administration and members for the administration to show up so that we can verify numbers with them. We told them we were going into session at 8:30. So it's 9:05 right now, and we still wait for the administration. I want to thank the senators that are here, and also I want to thank GMH for being so prompt and diligent. So we'll go into recess while we wait for representatives from the governor's office. We're in recess. The Committee of the Whole is back in order. Welcome to the Department of Administration, Mr. Byrne. We appreciate you working with us this morning. And now that we have everyone here, colleagues, we are going to the second bill on the agenda, but I'm going to go ahead and once again reiterate the rules. Proposed amendments must be submitted in writing to the clerk via email to session@guamlegislature.gov and must be submitted before the second round ends. Amendments will be processed in the order they are received, and replacement is considered a new submission. There will be 2 rounds as well for Bill 187. In the first round, each senator is allotted 10 minutes, excluding responses, for discussion and questions to the panel. A reminder, you can only yield your time to one member, and that member will receive all of that time. After completing round 1 of questions, panelists will be excused. Amendments or final comments will be in round 2, and that will be for 5 minutes. We will proceed with the amendments in order as received. Amendments not submitted in writing to the clerks and uploaded to the Google Drive folder before the start of the second round will be ruled out of order. After we finish amendments or final comments round of the bill, I will then allow the sponsor of the bill to close, and I will entertain a motion for the recommendation of the Committee of the Whole, and then proceed forward to rise out of the committee. At this time, I will recognize the sponsor of Bill 18738, Senator Sabrina Salas-Montanani, to open on the bill and also start the questioning period for the panel. Senator Montanani, you are recognized.
Thank you, Mr. Chair. I respectfully ask for your support, my colleagues, on Bill 187, which now directs $19 million in verified savings from the BPT bond refunding to the Guam Memorial Hospital. During markup, we amended the bill to reflect testimony from the Guam Economic Development Authority confirming that $19 million is currently available for appropriation. And we also incorporated important input from GMH leadership provided during that public hearing. I want to explain why the original bill identified $32 million. During debate on the governor's substitute budget bill, it was revealed publicly that the refinancing would generate significant savings. As the oversight chair on health, and given the well-documented emergency conditions at GMH, I acted quickly to ensure every available dollar would support the hospital. The original version reflected the full savings anticipated over the multi-year bond period, because GMH told us directly that they needed both immediate relief and long-term funding for critical infrastructure. This bill was a direct response to active and ongoing communication with GMH leadership. Following testimony from both GMH and GITA, and through public hearing process, we amended the bill responsibly to focus on the $19 million currently confirmed and ready this fiscal year. That amendment ensures alignment with real-time hospital priorities and transparency about available resources. GMH provided clear input during that hearing, and those needs are reflected in the amended language. Now, before I was sworn in, I have been working closely with GMH, walking through the facility, listening directly to hospital needs, and advancing solutions step by step. This bill is another example of progress, not politics. This is not about credit. This is not about whose bill number is printed on paper. This is about the patients depending on GMH every day, and the employees who show up every day when resources fall short. So again, I ask my colleagues to please support the passage of Bill 187.
Si Jusmasi, Senator Montanani. Senator Chalai, you're recognized for questioning. Or, I'm sorry. Senator Montanani, do you have questions?
Yes, I do. Right before the Committee of the Whole, I did receive a letter from the Department of Administration, Mr. Byrne. If you would like to read the letter? Or if you don't have a copy, do you have a copy of the letter?
No, I have
Yes,
a copy,
okay.
thank you. With your permission, Mr. Chairman.
Yes, please proceed,
Thank
Director.
you. It's headed Re-Bill number 18738, COR as amended. Dear Senator Montanani, Department of Administration views the savings from the debt service payment as a viable source of funds for appropriation to Guam Memorial Hospital Authority. Debt service payments correctly stated in the amended bill as $19,765,714, the actual reduction in expenditures already appropriated under Public Law 3860. The savings were achieved through a successful bond refinancing during fiscal year 2025. Accordingly, such appropriation is available for reallocation whilst maintaining fiscal integrity. DOA and BBMR is pleased that such funds are going to be appropriated to GMA to the benefit of all who live on Guam. And for the record, I have Mr. Carlson's consent to have included BBMR in the letter.
Thank you, Mr. Byrne. To the Guam Memorial Hospital, I guess if we could go over the amended language in terms of where the 19 million will go.
Thank you, Senator Matanani. To review the proposed bill, GMH had indicated projects that were proposed in its FY 2026 budget request specific to capital improvement projects. In it, we disclosed about 6 primary categories, which include amounts to structural and architectural projects, for utility systems projects, for alternative care site projects, medical equipment, information technology, and finally for a medical transport vehicle. The bill was able to contain, I believe, 100% of what was proposed back in the budget hearing in May, and listed for a number of projects as provided in the bill.
Senator, before you proceed, I just wanted to mention that I did tell the panel we didn't swear them in again for this bill because they were reminded that they are under oath. So all these statements being made are being made under oath. Please proceed, Senator Montanani.
No, I was just going to, thank you, Mr. Chair. I just wanted to add that we are thankful for the testimony furnished at the hearing, which included a request for authorization to reprogram funds was also included in the committee's amended bill. So thank you for that. We were just discussing with operations. There was just one consideration that we were hoping to entertain by the body, wherein if there were projects that on occasion things happen, an emergency may surface that may require us to invest CIP funds that may not have been contemplated at the beginning of this draft of the bill. We could potentially serve the body with a proposed amendment that gives us the flexibility to say for these projects and potentially anything else that might be considered an emergency. One of such emergency that was just shared with me over here was our fluoroscopy system that was since received, and then we determined that we would like to procure a UPS for the fluoroscopy system. The challenge is we don't want to plug it into direct to the main electrical source, and that's a big investment of equipment, and should another power fluctuation occur, we risk losing that equipment if we don't properly maintain it. And I also believe the vendor described to us that they could potentially waive our warranty if we don't take particular steps to insulate that. And so the cost for the ups, because it's such a substantive equipment, was estimated to be around $90,000. So we would like to use a portion of the funds, if authorized by this bill, to provide for that. So I can furnish what that amendment might look like so that you can consider that with your colleagues.
Thank you. I just had a couple of other questions for GMH. Do you agree that I've been working with you to improve the Guam Memorial Hospital? Would you agree?
Absolutely, Senator. We're deeply appreciative of everything that you've done. I've only been on this position for about 65 days, and I have met with you very frequently in those 65 days. But I know that prior to me stepping in as interim CEO, you have been advocating for the hospital, and we're very thankful and deeply appreciative.
Would you agree that there has been progress at the Guam Memorial Hospital in the last 9 months, 11 months?
Absolutely.
Thank you. I have no further questions.
Sijus Masi, Senator Montanani. Senator Talahi, you're recognized.
Susan Mossing, good morning, everyone. That was very sweet. The progress from the last 9 months, what do you mean by that? Do you mean the contracts that you've actually been able to put out? The construction that you've actually been able to begin? The work with GPA?
Correct, Senator. A lot of these were items that I think, like the interim CEO, I'm new to the organization, but we have heard from our colleagues that these have been continuous listing points or projects that have been expressed to the body, but resources are finite, and it wasn't until the 38th legislature that we started to see those requests get approved and provided for. A lot of these projects have been for a number of years. And a clear example is the electrical panel was a main topic for at least 5 years since the Army Corps of
Since
Engineers
the 10 million
provided.
appropriation in 2019 that GMH never received or demanded, right? And the maternal child health project that was funded since at least 2020, but never again taken up by GMH or used,
Well, actually, it was, Senator.
and all of the projects that are gone out, right? Some of these were from ARP funds that had been removed by the governor, is that correct? They were supposed to be funded. All of this, electrical panel, elevators,
Senator,
you're right. These are
is your
things that have been
question-
going on for a long time.
Is your question to support what Senator Sabrina Salas-Matanani is asking? Because she's right. In the last 9 months, 11 months, we have definitely seen progress, and she's been a big part of that progress. But what I'm hearing from you is you're talking about past, and there's no doubt that this legislative body in the past has also supported Guam Memorial Hospital. But in the last 11 months, we have seen a lot of support, and that is what we're answering.
All right, I'm just asking, yeah, how did this support come about? But that's okay. I wish Yuko was here, because Yuko could tell us how long we've been talking about this elevators, the maternal child health ward, all of these. Previous legislatures, even before my time, have been trying to help GMH. But I just want to know, I'm very glad to support the funding source in this bill. It is very concrete. There was a testimony from Gita that's been attached to the committee report on this bill that was actually submitted on Bill 188, sponsored by Senator Taitagui, where Gita confirmed that the debt service savings is in this amount. And the bill, this current bill before us by Senator Salas-Matanani has been amended to reflect the correct amount that Gita stated in their testimony. Gita said that this is now available, and they confirmed what DOA has said this morning, that these are savings now because of the budget. We had not taken in that savings during the budget process. So we are able to do that right now for this fiscal year only. The list of projects that have been submitted, can you just tell us from the list of the projects that were crossed out of the bill, deleted, are those still going to be taken care of, or are they not going to be done?
Senator, if there was a listing that would show for us what was crossed out, we can respond to that.
The bill as was presented in the public hearing. The listing is different. Now we've got these groupings, and I just want to know, were there any projects from the first public hearing taken out?
My understanding is those that were removed is because we were funding, in particular, there was the $5 million for the electrical panel, which of course we now are using the funding from the 40 million. Likewise with the IT network infrastructure, we're using the $40 million funding, and therefore that was removed from this bill.
So the electrical panel replacement, right? So everything else from that original list is now in this list, plus more? All right. And they're all grouped together. Why is that? As opposed to the original way where we knew the cost for each item. Like we knew exactly it was going to be $815,000 for the hospital center parking expansion. Now the Center Island parking expansion's lumped together with the maternal child health renovation and those things for $5 million.
Thank you, Senator. You raised an interesting point that we took into account at the hearing, which was how we qualify prioritization of these projects. And so it may be determined later when the bids go out that certain projects may account for an amount larger than what the bill proposes. So to achieve results for primary or prioritized projects, we group them in these respective categories with a particular amount attached. So for example, the first category, which you find on page 2, line item 23, it purports to provide $5,188,000 for structural architectural projects, and it lists among them Z-Wing demolition and retrofit, an MIS server room upgrade, maternal child health renovation and expansion project, and the hospital center island parking expansion. So if the prioritization is for maternal child health renovation expansion project, and that project takes up the full amount, this gives us the flexibility to dedicate those amounts to that project, versus saying only a certain amount for the maternal child health, and we could not have an opportunity to pledge the other amounts that we put as a lower priority for this particular one.
All right, so are these listed now in the priority, GMH's priority?
These are listed as groupings based on the CIP proposal and the FY26 budget. The priority would come in when the proposals come in. And for example, there are certain projects like the maternal child health
So
that
which are
remain
the
top priority.
priorities? I don't understand. If this are not grouped by priority, then what are the priorities?
Because the earlier bill had amounts specific to individual projects.
Yes.
We wanted the flexibility to say if a priority project like the maternal child health and renovation expansion project were to come in at amounts higher than what the bill originally proposed, we'd have the flexibility to pledge this full amount, $5 million, up to $5 million, towards that project.
All right, reprogram the funds.
Correct.
Right, so what are the priorities if this is not listed in the priorities?
Well, all of these projects are aimed to be funded through the appropriation of this bill. We're going to pursue all of these projects, Senator.
You just told me you have priorities. Just tell us what the priorities are. So, because already you have reprogramming authorization, but they're lumped together. So can you just explain which ones are the priorities in this lumping? Or is it number 1 is the priority and then number 2?
Well, they're not named number 1 or number 2. We simply listed all our projects that were furnished to the body in our FY 2026 budget.
All right, well, I don't understand. It was very transparent before when you give us actual approximate costs for these things, and now you don't want to tell us what the priorities actually are. I guess I just want to know, there was an announcement that you were already breaking ground or doing something on the parking. Is that not covered by this Hospital Center Island parking expansion?
It is covered. Even the maternal child health had a previous appropriation, but these are projects that we don't estimate what those amounts will be until the bids are awarded.
So what was the source of funding for the parking that's not included here? I mean, why do you put it here again?
That's from the hospital operational budget, Senator. These amounts that you
So what was that
on,
amount of the project that had already begun? How is it different from this?
For the Center Island parking, the amount's $815,000. And so it's still the same amount that you saw in the previous bill. All we did was lump it into this one.
No, I'm asking about compared to the announcement that was made in the media that you guys had broke ground or something on parking expansion. How does that relate to all the parking projects that you have in here? Are those additional? These are separate projects? We're going to do several parking projects?
They're not, Senator. They're no different in the project, but if the contractor were to pursue the work and identify for us things not originally contemplated when the bid first went out. We're building in a contingency fund to account for those changes. But generally, those are already provided for by our operational budget, but it remained with the bill because it was previously listed in the bill. But now that we know that this is covered by our operational budget, we know that we can pledge that amount towards the other items listed within the same subcategory.
Well, according to the bill, you can pledge them to any other item in your long listing, but now in your to anything.
Correct, Senator.
Again, this lumping doesn't make sense. So which of these projects then do you already have funding for? The maternal child health, the hospital parking expansion.
And these are partial amounts, Senator, for the maternal child health renovation and expansion project. We've yet to close on that particular procurement. When the procurement closes and the bid's received and it is awarded, we can finally determine what is the true cost. But there are budgeted amounts that have been provided to this
for
body.
which projects?
That have already been
For
initiated.
which projects? Yes.
So for example, the maternal child health, as we mentioned yesterday, the IFB is out. Yes, there is a funding source, which is Public Law 36107. But again, as Mr. Kenga had explained, this was also part of why it's in here is it's as a contingency because should the amount that ultimately the bid should the amount of the bid that ultimately comes in and gets awarded is more than the amount that we have allocated in the Public Law 36107, then we need this additional funding here as an authorization. So that's, as an example, one of the projects that we're working on currently. The SNF chiller pumps redundancy system and the removal and replacement for the SNF HVAC chilled water lines is another project that...
Which numbers are those under?
I'm on category 3, which is the alternate care site projects. Those, as you mentioned, we were originally going to fund it under ARPA, and unfortunately, when that funding was taken away, we still need a funding source because it's still an important project for us to complete. For example, and then likewise for number 4, under medical equipment, the med-surg beds. Again, that was something that was originally supposed to be funded under ARPA, but we've already placed the order. We're waiting for that to come in, but we need it. And so hence the reason why it's still part of our listing.
So how is it funded?
Currently, right now it's pledged with our collections, GMH's current collections. And many of the other projects here, we have not yet started because we're waiting for a funding source.
All right, so you're saying only 4 projects you've begun here?
No. The angiography suite, that is related to one component of our angio suite. And as you know, last year we had a ribbon cutting for our angio suite, but there's a component that we're waiting for, and that's what that is. It's actually almost done, if I'm not mistaken. The anesthesia machines is an one that we pledged our collections, but but we need this funding.
Why do you say that if you've already pledged your collections?
Because these were projects that we would have used ARPA funding for. And when we lost that, the projects were already on order, and but we still need the funding source. And so right now we pledged our collections, but of course, if we can use CIP funding, that would be more ideal for us, considering our financial situation.
But you've already budgeted for operations to cover that, right? So the 1 to 5 now? All right. I wish we could get a priority listing so that we could follow along the progress of GMH with its priorities for this funding. These projects include even more than the ARPA projects, right? Or your current projects.
I think, Senator, to help enlighten for the discussion, these reflect critical projects. We actually have an exhaustive list that we can furnish to you to show all the remaining projects that are not listed in this proposed bill.
I'm asking of this huge list, which ones are the priorities? Which ones
these
are we
are-
going to see prioritized?
Correct, Senator. These are the critical projects. We can again share with you the exhaustive list that provides you close to 50
But you
projects.
can't
that need
share
to
with
be-
me how the priority listing goes with this list of projects? You've always been able to do that.
Well, Senator, you're asking us to, among the critical projects list,
Yes.
which are the most
Yes,
critical.
because you're the one saying this money might not cover everything.
They're
right?
all critical, and actually the projects that are listed will be provided for with the appropriated amount indicated in the bill.
You said it might not cover everything.
No, well,
Now
if
it
in
will
the event
cover
the bid
everything.
comes back and it comes at an amount higher than what we projected.
Of course.
But based on our market survey, we've determined that we have sufficient amounts listed.
Okay, so according to your market survey, how much more do you need for the maternal child health renovation project that you said is out for bid right now?
Sorry to.
I can't understand why we can't get the details. Yes, go ahead.
Ma'am, it's very difficult for us to detail prioritization because even though the projects are being awarded or to be awarded or bidded out, what your assessment today, and once you apply and award the project, there is what we call deferring site conditions. For the duration of the project, things might just happen.
Of course.
Or they might just discover something. So we want to make sure that those are covered within our means.
But
And
in
we
order
don't have
to
that
sign a
means.
contract, you have to sign an amount, right?
Yes.
You have to budget an amount, and you, all right.
Senator,
Just-
you're just asking for a listing, right? With the-
Absolutely.
Yeah,
Your
we
priority
can furnish
listing.
that
Like, is the
listing.
parking lot going to go before the maternal child health? I guess that's what happened. Is the HVAC replacement that we've been talking about and the elevator project's going to go before, some other stuff? That's kind
Senator,
of what
they're
we
all
wanna know.
happening simultaneously, right? We have the chillers here. We had the groundbreaking and the roof and envelope. We have the IFB out. Everything's being pushed out for all of these
All right.
projects.
The groundbreaking for the roof and envelope, so what here, you need further funding for that project that you've already done groundbreaking on?
Not for the roof and envelope. What is in here, for example, is like, let me just clarify 1 second. Yeah, specifically for the roof and envelope, what you will see here is the roof mechanical HVAC upgrade that we have not procured yet. And that's why we need the funding, just to clarify.
All right.
But
and-
the roof and envelope itself, like I mentioned yesterday, is through the Public Law 36107 funding.
That's what I thought. That's why you're able to do a groundbreaking, right?
Yes,
Okay.
ma'am.
The medical transport vehicle, is this to replace one, or what is this for?
Yes, we do have one that continuously breaks down, so we need a replacement.
And what does it transport to and from?
It is it's actually a non-medical transport vehicle. So meaning to say, it's to transport our patients to, for example, if they need to get an MRI, because we don't have an MRI machine, we would have to bring them off-site. So that would be an example of what the vehicle would be used for.
All right, the previous listing on the original bill showed this MRI, building demolition and renovation. Is that in this new listing?
No, ma'am.
All right, so there is no MRI planned. You're going to continue with the same system, transporting for MRI?
For now, yes.
All right. Who's going to lead the procurement on these things? I don't believe they've all begun. Who's going to do that?
For the procurement, it would be our materials management team together with Mr. Jesse, myself, Mr. Zaldi.
All right, and the, Mr. Jesse, personnel, HR? Okay, and what, you said that you were going to use 10 million to pay for IT infrastructure and you're waiting for the infrastructure agreement. Does that mean you've already procured it? That's from the
Well, there was a
40 million.
corrective action plan submitted to HHS that we're awaiting response from HHS as to our proposed plan of action. They were in a government shutdown. We only recently received word back clearing us to proceed with our projects.
So is the 10, are you waiting for an infrastructure agreement on the 10 million?
We listed the projects with HHS, and this was recently cleared by them to go ahead and proceed.
So what does that mean? What is the status of the IT infrastructure?
Right now, it's with our legal team to produce a letter to inform the Attorney General of our intent to proceed with the procurement, and then it'll go through the normal process, Senator.
Why are you writing a letter to the Attorney General?
That's our procurement law, Senator. We advise the Attorney General of every phase of the procurement.
All right, so you're just beginning your procurement process
Correct.
for the IT. So there's no agreement that's pending. You're waiting to do the whole solicitation. Is that correct? Or do you have a sole source?
We're done. We're done with the whole proposal. We're waiting for a concurrence by the Attorney General as to our
So you've
plan
already
phases.
solicited and awarded?
Not all are
Can
in
you just tell us the
solicitation.
status, please? Yeah. What happened? You said you're holding the 10 million, but in the meeting you said you're waiting for the infrastructure agreement. So it sounds like the procurement has been completed. So what is the status?
There was a draft contract that was prepared, Senator. This contract was shared with HHS as a condition for a corrective action plan. There was a citation issued to the hospital around the time I first started. HHS only recently responded in the affirmative that not only did they receive, but they concurred with our proposed plan of action. And now we're proceeding with the procurement to inform the Attorney General.
All right, and did the Attorney General, was he part of your procurements, your solicitation and award?
The Attorney General is apprised of every phase of procurement,
All right.
Senator. Yes.
So, okay, and who is this awarded to?
There's no award currently. We're going through the phases, Senator.
You've done a selection. You've done a solicitation and a selection, and you're writing to the AG to approve the contract?
We're writing to the AG to inform him of the process that we're pursuing.
So can you please be transparent? Just what stage are you at in your procurement?
Senator, we're producing a letter from our legal team to inform the Attorney General as to our initiation of the procurement for this IT project.
So you haven't done a solicitation yet? She just said you did. That you've completed it and you're waiting now and you submitted everything.
So
your
there are
contract.
several phases to this, Senator, and not to confuse the body, but in essence, we were issued a citation from HHS. We produced a corrective action plan. This corrective action plan was subsequently approved. Subsequent to the approval, we went ahead and produced a letter informing HHS of our intent to produce this procurement and advise our Attorney General. Only recently did we receive the green light to please proceed, and we approve your proposed plan. Once that is awarded to a particular vendor, Not only will the Attorney General know, but we will also share with the body what has been concurred.
All right, and the RCM contract that you are seeking, how's that funded?
This will come from the operational budget of the hospital.
And the media contract, how is that funded?
Operational budget of the hospital, Senator.
All right. Who was the previous RCM contractor? This one's already out for bid. Yeah, who's the previous contractor?
So none of us, well, I can speak for at least the interim CEO and myself. We won't be able to give you a
I
clear...
think it's called MedHealth. I think it's called MedHealth.
MedHealth? What were you saying?
But we prefer to work with our fiscal team to produce actual records to the body so that anything that is shared to you is factual. We're new to the role. I don't think we were present during that award of that contract.
Yeah, the findings from that was that the services were unreasonable. They were preferential treatment towards the hiring contractor for RCM services. Unreasonable basis included the contractor's 12% compensation, resulting in question costs of $4.9 million, and ineffectiveness of the RCM consultancy due to continuing cash flow and patient receivables issues.
Thank you, Senator. Your time
Will
has
any of this
expired.
money go to the
This will be your
RCM
last
contractor?
question.
No.
Senator Barnett, you're recognized.
Hey, Sidus Masi, Mr. Chair, and
You're
Biba
welcome,
Betness to the people of Guam, and good morning to the Guam Memorial Hospital. It's good to have you here on this Friday morning. I just kind of wanted to continue on the revenue cycle management. I'm going to go ahead and read a little bit because you had mentioned it yesterday, and I want to just get a little more clarification on it. From OPA report number 2401. Their review of the procurement agreement, billings, and payments relative to the performance of the revenue cycle management services for the Guam Memorial Hospital Authority found deficiencies in GMHA's procurement process in complying with Guam procurement law and its procurement regulations, factors indicative of preferential treatment towards hiring the contractor for RCM services, unreasonable bases included in the contractor's 12% compensation, resulting in question costs of $4.9 million, and ineffectiveness of the RCM consultancy due to continuing cash flow and patient receivable issues. The OPA further questioned the $4.9 million paid and are recognized as payable by GMHA for contractor invoices issued for July 2021 to October 2022 due to the contractor's non-performance of collection functions for self-pay patients and third-party insurance, non-involvement in the Medicare cost reporting, and the apparent lack of effort in collecting from regulated payors, including in the billable AR mix. So, Doc, as you know, you brought up the revenue cycle management yesterday, and this is kind of all we have to go on. So how can we ensure the people of Guam that when we're going down this road of revenue cycle management and, you know, trying to procure a contract for an outside entity to do that, that we're not going to run into the same issues that were cited in the public auditor's report?
Sure, Senator. So the contract for the RCM, the revenue cycle management, and just for the record, in case we're not familiar with what a revenue cycle management is, it's the entire financial process that turns our clinical care into revenue. It includes registration, documentation, coding, billing, denials management, and collections. If we fail at any point of those particular areas from the moment that a patient walks into the hospital, then we don't get paid, and that's the bottom line. The prior contract was a consulting firm. It was limited consulting firm. What has been pushed out in the RFP is a full RCM manager. This is beginning to end, and this is on-site, not consultants. These are national expertise that will come into our hospital and work closely with us because we lack the capacity to do this. The RFP is available for you to pick up, and you can compare the details of the prior consultant in that process. We've had our legal team look over this. It has been vetted by the executives, and Yuka wrote most of it, but we used national standards, key performance indicators, transparency, and accountability reporting so that we can see everything.
Thank you for that information. And right off the bat, the fact that you have an RFP differs from what the OPA had reported on with the previous contract, in that there was an unsolicited offer and a sole source procurement. So I just wanted to offer you the opportunity to clarify the issue of the outsourcing of the revenue cycle management. Thank you, Doc. I also wanted to, if you could follow up on what you had said yesterday about a reduction in force, $10 million reduction in force cost savings that's going to be presented to the board. Are you able to elaborate at all whose jobs are going to be reduced?
So the board passed a resolution to allow the executive team to implement a reduction in force. And that's actually part of the law and a specific process that we'd have to follow should we go down that path, which is not a path that we're trying to follow. The $10 million should be something that GMH is able to accomplish if we continue our deep dives and look into our processes and become more efficient. And part of that efficiency is the revenue cycle management. Making sure that we're collecting on the clinical care that we're providing. And when you're outsourcing, what happens is they're going to come in and the vendor may absorb some of our staff, which will decrease our operational expenses because our personnel expenses will go down. We expect that attrition is going to happen, and we will be retraining and reassigning the remaining staff. So just by virtue of the outsource, the hospitals will undergo a natural reduction in force.
How much do you anticipate the reduction in force associated with the RCM contractor absorbing the RCM staff?
We won't know. We won't know until we I guess, award this and have conversations, and then we'll understand what's left. But GMH will remain the body that's accountable to this RCM to make sure that we have full transparency and accountability.
Doc, are you able to provide any other information? Because $10 million in reduction in force.
No, yes, I am. Actually, we've been doing
reduction.
this every day. So let me just give you some other information. Every department has been looking at how they can cut costs. The operations just did a presentation looking at what was budgeted and what was actually funded, looking at overtime in their operations and the outsourcing of security, as well as environmental services. And the total savings that operations alone would be able to find for the hospital is roughly $2 million. For fiscal, there was a presentation done by Yuka, and with the outsourcing and also really looking at the staffing pattern, because we're overstaffed in some of our departments. Her overall decrease in her bottom line would be roughly $2 million. Right now, Dr. Eusebio and I are looking into medical staff. We are optimizing the operation. We're looking at our contracts. We did obtain the MGMA. We do have the deep dive. We have compared it to 2021. I will tell you, physician salaries have gone up. but that doesn't mean that we're not optimized, or that we are optimized in our current operations. So we're looking at everything again, and we alone, I think in the past few days, have already cut $500,000, and we're continuing to go through the contracts to see where else we can become more efficient. And so that's medical staff, and we're still working through that. We have our clinical side. We have cut a lot in overtime. We have found areas that we need to improve on. You know, we have education that can likely be rolled into the day's work instead of paying additional hours to attend specific things that are mandatory. And so our clinical leaders are looking at other ways to be more cost efficient. This executive team has been working very hard to carry out their fiduciary responsibility, to be fiscally responsible, to find that 10 million. So at the end, when it's time for us to come back to this table, we are not putting our hands out, Senator, and asking for the same amount. We're hoping that we can decrease what we are asking from you by at least 10 million.
Thank you, Doc. You had mentioned that you're overstaffed in several departments. Can you elaborate further on that?
So the preliminary review of the fiscal leadership is that there are some areas, and it's because we're inefficient, right? We're on manual mode with a lot of our systems. They're very legacy. We're still on the AS400. I don't know who else is still on the AS400, but it takes 5 people to do our payroll. And it also causes us to have overtime. So we're looking at software upgrades. We're going to change out the AS400. We are already looking into, and thank you for the increase in the small purchase, because we can actually do it now. We're looking at changing that out, becoming more efficient, requiring less manual labor, decreasing that overtime. We're looking at ensuring that our inventory is matching up with accounting's numbers, because they don't currently match up right now. You know, we don't know when we're really low. We can't actually track that. And that's real. That's the reality. There is a lot of waste that we currently have, and we're trying to be responsible about it and decrease the waste. That's actually going to be part of our 10 million, because as we upgrade our software and become more efficient, we should be able to save a lot more money. The hospital needs to come to the 21st century. It needs upgraded systems. It needs modernization. You know, we have to change out how we're doing things, because it's very inefficient and it is not cost effective.
Thank you, Doc. So outsourcing of services, outsourcing of contracts, and you're throwing out $2 million a few times. I think in my mind I'm up to around 6, but I just want to ask, because when you throw out terms like reduction in force, I mean, that's just corporate speak for people who are going to lose their jobs. So what I'm trying to get to is how many people at the Guam Memorial Hospital's jobs are going to be at stake because of this reduction in force, and where would those potential cuts be made? Or are we saying that we're going to cut $10 million and miraculously no one is going to be out of a job?
Senator, to address those concerns, we've actually held multiple town halls with our employees to advise them of what the process is. This is a timed and planned process. If any individual who's in the merit system's job is affected or will potentially be displaced, we describe to them that it begins with a letter issued by the CEO, and only after that letter, we have to wait a minimum of 30 days before a subsequent letter is sent out to the individual employees affected. From that point in time, an additional 120 days is waited, and the employee has rights to appeal to the Civil Service Commission if they feel that we've violated any part of the process. So there are rights that we are maintaining for the employees.
Thank you. So have you begun drafting any of those communications, or have you initiated any of those processes?
We have not, Senator.
Okay. And then there are other types of employees who don't have those same types of protections that the employees who toil at the merit system. do? Is there going to be another process for some of these unclassified hires, I guess?
Unclassified LTA are at-will hires of the CEO. So if it is determined that a department is bloated with individuals beyond what is an appropriate size and they occupy positions that are unclassified or LTA, those conversations will happen with the department manager and the administrator.
Which departments are bloated?
Well, right now, Senator, I wouldn't describe that. That just seems to be a common perception within the public.
Those were your words, Mr. Kagan, not mine.
Correct. So I'm returning those words based on our conversation offline yesterday. You described what is public perception. And so for the public to understand, we recognize what the perception is. And so we are identifying where those areas are and informing our employees of our process.
So that's got to be quite a balancing act because you're saying you're going to reduce $10 million. Are any of these cuts going to affect patient care or patient services?
Absolutely not. We're not going to find 10 million in reducing the staff altogether, Senator. We're going to save it or we're going to make it. We're also looking, and we're going to come to this body, we will meet with our healthcare chair, but we're looking at areas that we just lack capacity. We want to be more efficient. We want to bring the hospital up, and we want to be fiscally responsible when we do it. And I know, and I'm just going to, because I keep hearing it, and maybe you're going to ask me about it. I know that you brought up the PIO. I know that that might be something that you want to discuss, and I'm open to that discussion. Let me just get my notes. So, I truly believe that having someone who is qualified and highly skilled is responsible, and it's a risk-reducing for the Guam Memorial Hospital. It protects patient care and staff's trust. It supports accreditation efforts. GMH has critical communication needs. This ensures transparency with the legislature and with the community. We talked about $55. Right now, if we were to fill in our director's position, our comms director's position, the high end of that is $101,296 plus 35% in benefits, which totals $136,750. If we took the 55, because it's actually a part-time position, we're part-time or as needed, and let's just say that that firm put in full-time hours, it would total $114,400 with the difference of $22,350 in savings for the hospital. Plus, there's no long-term liability. We don't pay into retirement right now. The hospital is under a lot of scrutiny. We need to work on improving the public's trust. We need to be able to have someone who is skilled in communications so that we can get that message out.
Thank you for that, ma'am. So how much has been billed to this company, AB, what was it again, sir? I know I asked about this in the public hearing.
For the 6 weeks, a total 40 hours has been billed to the hospital.
And how is this procured, this contract?
Standard procurement process, Senator.
Okay. Thank you, Doc. And again, I think when we hear about a lot of the issues ongoing at the Guam Memorial Hospital, and then we hear things like messaging, hiring a media firm to improve the image of the hospital. I think, how we improve the image of the hospital is we continue to chip away at a lot of these legacy issues, because, my assessment of it, just based on my short time as a senator and coming from the media, it's for the Guam Memorial Hospital basically has been left by the administration to kind of die on the vine because all of the efforts and this has even been reiterated by the current chair on health, all the efforts have been directed towards the construction, development, pursuit of the new hospital in Maguilao. And my estimation is that we've now reached the point, unfortunately, where it's critical. I mean, it's been critical, but now the legislature, I mean, even in the previous term, we were always in here trying to assist GMH, but for whatever reason, the support from the administration hasn't always been there. So that's definitely been frustrating, Doc. And so I hope you can understand that for the general public, when we hear about the issues from the Guam Memorial Hospital, and then we hear on the other side that you've hired a PR firm that may or may not be connected very closely to the administration. Of course, people are going to scratch their heads, but at the end of the day, I mean, I come from the media. I understand the need to communicate information, but it's really just for the people of Guam a matter of priorities. And I think a lot of people might say that, hey, instead of worrying about the messaging or coming out with ads, let's just do the work that has to be done. And I'm sure you can appreciate that perspective, Doc.
No, I can, Senator. I appreciate that, and I appreciate you giving us the opportunity to explain it. I will tell you that the staff are so much happier that our communication has improved internally. They're very appreciative of it because it's low-hanging fruit for us that we need to actually continue to improve.
Okay, well, this bill, the funding issues aren't here like they were with the bill that we discussed previously. So obviously I support the measure, and I think that the former speaker had covered a lot of the details about the project, so I don't really want to go into that. I just wanted to ask again about the reduction in force. And then I'm also getting just concerns about the status of the electrical panel and just the electrical system overall at the Guam Memorial Hospital. At this point, could the Guam Memorial Hospital pass an electrical inspection from, let's say, a DPW?
So I think we all got those same text messages.
We sure did.
Let's just address the elephant in the room, because I'm okay with that. So let me just make sure that everybody is aware that hospitals are held accountable for life safety systems by multiple entities, primarily by CMS, which is the Center for Medicaid and Medicare and Medicaid Services, recognized accreditation organizations, as well as state and local authorities. The hospital leadership and staff are responsible for maintaining that compliance. Federal law requires hospitals to meet CMS's more stringent standards. Local government agencies, they review, the building code compliance, but they don't determine CMS life safety compliance. CMS is the federal authority that determines life safety compliance. It either inspects it directly or does it through a delegated accreditation body. And as it stands, GMH was inspected by CMS's life safety engineer in 2024 and is very well aware of the incident that happened with our motor controls overloading and causing smoke. So we are expecting to be inspected again. And that's actually the focus of GPA, is replacing the motor control panels as well as the auto transfer switch.
Thank you for that, Doc. Mr. Chair, thank you for the time this morning, and Biba Betness to the people of Guam, and Sidos Masi to the Guam Memorial Hospital for your time, and thank you as well, Mr. Byrne.
Sidos Masi, Senator Burnett. Senator Gumatauto, you recognize?
Thank you, and good morning, Mr. Chair. Thank you for the panel. Just if I can, for Mr. Byrne again, can you, on the record, confirm that the savings from the debt service payments as a viable source of funds for appropriation to the Guam Memorial Hospital in your letter, is that what you're saying this morning in your letter to us?
Yes, sir. That's what my letter says.
Yes, thank you so much. If I can, to GMH, on page 3 of the marked up version of this bill, I just want to ask for the record, what portion of the projects are identified, again, on page 3 or so, going into page 4, have been or will be covered by the $40 million subsidy that was approved by this legislature on September 11, 2025, and signed into law several days later?
Hi, Senator. None of these. The original bill, before it was amended by the committee, included the 2 projects already appropriated in the 40 million, and the amended bill by the committee removes them. So the items remaining are not covered by the 40 million appropriated previously.
All right, thank you so much for that. And I just wanted to make this comment again. In 11 months, I have been at the public hearings. I have visited GMH not only as a lawmaker, but also as someone who was visiting a very sick family member. I just want to say that I get it. I've heard it. I've seen it. We need action, and I hope that with this bill, when it is passed by this body and sent to the governor, that you do not let us down, that we commit to you, you need to commit and execute on this public policy. I'm hoping that it's going to get done, that we don't have to be back here again in 11 more months, and then there's something different. So I plead for your support, Doc, for you and your team, that when these resources are here, other agencies are seeing the action by this body. If you cannot deliver and you cannot execute on this law, there's other agencies, quite frankly, that need this support. Your credibility would be totally toast, and then we're all stuck in a situation that we don't want to be there. So please, I ask and plead with you, we pass this, the governor signs, do not let us down. That's all I have. Thank you, Mr. Chair.
Si dus masi, Senator Gumatato. Senator Perez, you're recognized.
Thank you, Mr. Chair. Good morning to the panel. Yeah, I think a lot of the questions were asked, and it looks like the bill addressed some of the issues regarding the amounts, as well as to ensure that there's transparency and accountability with the reporting requirements, and I think that would be good to ensure that progress is being made. I guess, when it comes to procurement, these are very specialized equipment, and to what extent have you sought expert advice, like with OTEC, for instance, when it comes to IT or any of these things? Because you mentioned earlier, if you can reiterate who was on the panel to select to select or award any of these solicitations. So anybody on the panel, if they can reiterate,
Sure.
I know there was a response earlier, but if you can reiterate who is on the panel for the selection.
Thank you, Senator. To address your first point, yes, our IT department is working in concert with OTEC, and we do have relationships with them even to migrate our domain from the .org to the .guam.gov and follow suit with what has happened here at the legislature. So that's the first point. The second point is, for the panel, for IT specifically, it's not a solicitation for professional services. It will be an invitation for bid, and that's simply awarded to the lowest cost of a responsive and responsible bidder.
Okay. So this has nothing to do with the information system for the hospital? So what exactly is being procured? If you can just kind of clarify that for me.
And Senator, can you clarify? Because again, the IT is not included in the bill. It's
Okay.
not an item for the bill. It was part of the Public Law 38-59, the 40 million.
Okay. All right. So for this one, what exactly is being procured? You said it's an IFB, so I'm just, yeah.
If the amounts exceed 250,000, Then specific to IT, you would look at the ups that would be required to handle the heavy equipment produced like the fluoroscopy system described earlier.
Okay, so how does this integrate with what's being purchased or procured in the other law? Is there any integration with that?
No, we would expect that
It's
the
separate.
5 million previously authorized would be sufficient to cover the total cost for our IT, for the first year, for the IT infrastructure upgrade.
Okay, so, but how does this integrate into that other procurement? Or does it? Do you envision it being integrated into it?
So the $5 million for the network infrastructure upgrade, that is really to upgrade our entire network. As we know, we have some issues there, and in order for, and Dr. Argan mentioned how some of our things unfortunately are very inefficient, which then requires us to do manual mode for certain things. And so the idea with the upgrade is that it would make what is standard in most places then become standard for us too, as far as our infrastructure is concerned. And so that's basically our foundation. And so for these other equipment that we're purchasing, not only for the IT, but also for like our medical equipment, it should help once we have that upgraded network.
Okay. The reason why I'm asking these questions because there was a case study where there was infiltration, a breach in one of the hospitals, and it shut down not just only the communications, but it shut down the instruments, the life-saving instruments. So that's where I'm getting at is have you thought about that in your
Yes.
procurement with this particular item? Is it integrated into your IT network system at all?
Hi. So just for the prior breach, I just wanted to mention that, yeah, that was way before my time, but it also, from my definition, I don't believe that that was really a breach. But, regardless, everything that we're doing here is from the ground up. We need to renovate or revamp the whole infrastructure from the bottom up. So from the cables in the in the walls and the ceiling to the switches to that is all to bring us up to par, because the systems and the infrastructure, the network, and even the EHRs and their interoperability with the other systems of the other government agencies, they have been neglected for the last 20 plus years. So this is, everything that we're doing here is all interlinked with each other. We can't have one without doing the other, basically. And, EHR is not the only system that we're looking at. We're also looking at human capital management systems. We're looking at enterprise resource planning systems. So this is, for an IT professional coming from the private sector, this is kind of a nightmare. So we're like, there's a lot that we need to change, and everything that we're doing here is all interlinked. And with the priority being protecting the PII and the PHI.
PII and PHI.
I'm sorry. It's a private, personally identifiable information and protected health information. Sorry.
Okay. So some of these are IFBs and some of them are they all IFBs in this one?
Depending on the amount, as we know, and again, we're thankful for the increase in the small purchase threshold. So anything over 250,000, of course, will require an IFB.
So all of these listed our IFBs? That's what I'm asking. Except for the number 6, possibly.
Oh, not necessarily, because depending, I think because you're looking at the total amount, right, for each of the categories, but if on an individual basis, if some of them fell below the 250,000, then they would just be through a small purchase.
And you haven't started any of these, or have you created the specs? Are the specs already completed?
We have some specs for some of them. Some of the other ones we're still currently working on putting the specifications together.
Okay. Okay, as far as timeline, what do you think as far as when will these be completed?
So I think that once the funding is in our account, anything that's under 250,000, we should be able to get quotations pretty quickly and hopefully done within at least I would say the first quarter of 26, because it's December and we're right in the holidays. So, we have to wait until we get those quotations in. For the bigger projects, it really is going to depend on the procurement process.
And in addition to that, as we know, some of these items will require more time. They're going to be long lead items, so they're going to take a little bit longer. I can foresee anywhere between 6 months to a year, possibly, for some of these items.
Oh, okay. I guess thank you for your responses. So yeah, I look forward to seeing it done expeditiously. But I'm hoping you're doing also the market research, because oftentimes we think we know what we want, but then we end up having to upgrade it, and it's going to be at a higher cost. Also including maintenance. So I don't know if service is going to be included in that. So is it going to be included?
Usually for the equipment, we do include some maintenance. Yeah, usually the first year or two of preventive maintenance would be included, including training as well.
Okay, all right, thank you. Question for Director Byrne. I don't know if you can answer this question. So I know the savings has been endorsed in this letter that you submitted. How soon can this money be accessed?
Thank you for that question, Senator. The savings actually accrue during the course of the year. So, in theory, the cash that the savings represent are actually going to accumulate during the course of this year, right the way through the year, because this is an annual budget. We will work, though, with GMH to get as much money as we can to them out of this amount as quickly as we can, because I heard what Dr. Uggan was saying about the need to get some of these contracts underway.
Okay, and so this is guaranteed? The savings is guaranteed?
It's a realized saving, yes.
Okay, so there's a chance that it's going to be piecemealed, the savings, but...
I will endeavor, because of what I just heard, which I fully understand, to get as much to them as quickly as possible.
So in order to do that, how is that money realized, I guess? Is it coming from the bond markets, or we're going to upfront the money first and then...
Yeah, it's going to come from our natural cash flow.
Okay, so it's going to come through the general fund, and then eventually we're going to get the money from the bond markets. Is that correct?
No, this is actually a reduction in what we pay in order to service the bonds. There's no money coming back to us from the bond market.
Okay.
That's a separate a separate task that we have to do.
Okay. So it's just the internal changes.
Yeah, the way it works is we pay, because this was a BPT refunding, we pay our debt service on the BPT over to the trustee, and when the trustee has enough money in their account, then they send the money back to us. So it's called a waterfall, basically. But that happens every month as we receive the BPT receipts.
Okay, so then how much is needed in that trust fund account?
Well, that depends on it's in the indenture, and they're all different. But a lot of the savings, when we refunded these bonds earlier this year, was because we were able to reduce the amount that was required by the trustee in that account.
Yeah, I'm just trying to get a picture of the volume, what are we talking about as far as volume in cash in one, period of time?
It varies for each bond offering.
Okay.
It could be anywhere between 11 to 30 million, depending upon the volume of the bond and the age of the bond.
Okay, so if it's 11 to 30 million, how much are we expecting to retain, I guess?
Retain.
Or
Well,
I guess that's 19 million. I'm just wondering what span of time are we expecting to see this money materialize so that they can move forward with the projects?
Well, as I say, it's basically rateable throughout the year, but I understand the urgency.
Okay. All right. So hopefully you'll get that soon. And because my understanding is you cannot go out for a contract if the money is not certified, correct? Okay, so then, yeah, it's like a chicken and egg thing, which comes first. But if, I think in the meantime, it seems like there's still a need to do all that market research and firm up the specs. The team, again, for if there's an RFP, are there any RFPs in this one?
No RFP.
No RFPs, okay. All right, so hopefully you get your specs perfect.
We will try. Thank you.
Okay. All right, I think those are my questions. Thank you, Mr. Chair, and thank you to the panel.
Thank you, Senator Perez. Senator Borja, you're recognized.
Thank you, Mr. Chair. I don't really have any questions, but maybe just some comments. And I feel like I need to say this because, during yesterday's Committee of the Whole, one of my cousins, who I don't really hear from a lot, was watching she works at GMH and doesn't necessarily follow the legislature all the time, but was watching, I'm assuming because they knew you guys were down here. And just through this whole process, she sends me a message and says, "Why do you guys talk like that?" And I'm like, "What are you talking about?" And when she said that, it just made me think about just the pressure and coming in here and having to go through the rounds of questions. I think for me, trying to explain why we do what we do, and her response not being in politics and saying, we get what you guys are trying to do, but there can be a more cordial way, I guess we'll call it. And I agree, right? And I can't speak for everybody. I told her I can't speak for everybody on this body. But what I want to say because of her message is that because they, as in the employees of GMH, feel sometimes like, at least now, when she said, like, you guys make us feel like we're down there begging for money that we don't need. Like, if you don't know, maybe you guys should come here, right? And that was a response to me, like, if you guys feel like we don't need the money, then maybe you should come down here and visit the hospital. Obviously, she didn't know I've been down there a couple times, but I just want to say that really thank you for coming here. I know you guys, Dr. Ugg and Jesse, you haven't been in the seat for a very long time. And I think, kudos to at least I can speak, and even the comment about, from them is they feel like they're getting a lot more support, hopefully, and we'll continue to do what we can here at the legislature. But really, thank you guys, and for those watching, I'm sure your team at the hospital is watching. But really, thank you for doing what you guys do, considering the circumstances and really the way the hospital has been over the last couple of years, despite whatever the narrative, whatever the governor's priorities, you guys still showed up and you guys still take care of our families and our friends that come through the hospital. And at least what I told her is that, despite what your leadership has to go through to fight for support at the hospital, that I can at least speak for my colleagues in our caucus that we genuinely want to help, and I'm not saying the other side doesn't, but that was my only message. And I want to make sure that I say that because I get it. For them, they see it as like, we're asking all these questions because we think that you guys are coming to steal from the people of Guam. But I just want to reassure them that, we trust in the leadership. I don't think there's any doubt that you guys aren't trying to do what's best for the people of Guam. But really, thank you to you guys for coming down here and going through these rounds. And please go back and tell the people and those watching at the hospital that we genuinely appreciate what you guys do for the people of Guam, despite really the years of neglect down there. And so thank you. That's all. Thank you, Mr. Chair.
Senator Bora. Senator Lujan, you're recognized.
Thank you, Mr. Chair. And good morning, Dr. Jolene and team, and Merry Christmas to all of you. Thank you for being down here. Just a couple of comments, actually, and I just want to start off by thank you for the reiteration about, it's an old hospital. And, you're going to be here again next year because an old hospital is breaking down. And so what we fix today is probably going to break down again, in a few months. So until we decide where and when this new hospital is going to be built, your infrastructure is going to continue to fall apart. So that being said, again, I just want to reiterate, in your end of the year review, that the financial back of the RCM contract, did not the collections of GMH see a $39 million increase from the baseline of 7.2? Did you not see an increase in that from the RCM contract?
So our CFO is not here, Senator, and she would definitely have a lot of this information, but in a conversation that we had without her going over information, she did initially state that there was an increase in the revenue that was generated with this consultation, with this consulting firm. We have not sat down and gone over any of the further details. That was a very short conversation, and we have not done a deep dive together. And I do understand that it has been audited. So I have no grounds right now to give you more information.
Yeah. Well, it was released by you guys basically in your, again, end of the year or end of the fiscal year. And it also showed that your monthly collections raised from the baseline of 7.2 to 9.9 million. Again, your pending claims reduced from 20 million to 4 million. So that's great news. You guys have done a tremendous job in that, and thank you again, Dr. Uggan, for your leadership. And as my colleague Senator Bora has said, sorry that you have to go through this. It's a scrutiny. It must happen at times, but I'm in a hurry to try to give you guys the money so you can fix the hospital. I want you guys to get out of here and go fix it. So with that being said, I'm satisfied, of course, with the letter that Mr. Byrne had submitted in regards to this particular bill and the viable source of this, and we knew that when we introduced the bill, and I'm proud to be a co-sponsor of this bill as well. So I'm just asking my colleagues, can we hurry up and get this voted on and given to the governor and give to the hospital to start fixing this old broken down hospital. With that being said, thank you very much, Mr. Chairman.
Sin response, Senator Lujan. Speaker Blas, you recognize. Thank you, Speaker Blas. Senator Titagui, you recognize.
Thank you, Mr. Chair. Good morning to my colleagues, and again, good morning to those who are here today to provide us answers to our questions, and as well as to hear your comments as well. And I think you agree, right, Dr. Uggan, that it's going to take a village to repair what's happening at GMH for decades. You know, it's neglect, number one. And of course, different management that has played a part in some of the good that has happened, but of course, a lot of neglect that hasn't. That's why we're here today, and I wish you the very best. I know you haven't been in this position for very long, but you're going to need more than one person to help advocate for this hospital. I hope you know that, and that you courage to collaborate with the other senators on this. Our oversight, she's done her best and doing her best, continue to assist you. But you and I both have discussed some concerns at the hospital, and hope I can help in my capacity, which I'm looking forward to doing for you. And of course, you know, I introduced a bill. It was only an hour after the author of this bill introduced it, right? And the amount that I put on my legislation was the correct amount. And knowing that this amount of money, I'm not knowing all, I mean, I knew all the issues that you had. The bill gave more flexibility. The bill that I introduced gave you more flexibility on what is really needed. For instance, you know, I know the MRI is something that's been talked about for years and years, that you guys need an MRI, you know, and you need this area particularly to be addressed on. Do you feel that if we gave you more flexibility instead of, you know, on this particular bill, pinpoint certain areas that you might be able to, well, not you might be able, that the bill tells you what you can spend on? Because a lot of times when you go through the process, you find out something else comes up that is more of an emergency, a need that could bypass. So if there was an amendment to this bill to basically just give you allow you to those, how would you say, it would address these issues for sure that are needed and identified, but however, in the event something else that comes up that's more important, would you be willing to have that adjustment made in this bill? Because, you know what I mean? Things come up all the time, and it could be reverted back instead of coming back here, taking forever to try and get some more funding. Because if anything, you know, of course I support this because I introduced the same bill with the right amount of money, you know, funding. I don't know why they had to take this bill and, you know, change it to my bill when they could have just used my bill. But, you know, it's politics in itself in this body too as well. So for me, it's about credibility and accountability in this body, but unfortunately, we have to deal with the shenanigans here as well. But so back to my question again. Sorry, I didn't need to divert, you know. Trying to find out if there's an amendment to allow more flexibility for this funding.
Thank you, Senator, for that. We definitely brought up the flexibility of being able to, in this bill, to shift some of the funding should an emergency arise. And one of the examples that our team had brought up is the UPS system that's necessary for one of the equipment that has been recently purchased. But another amendment that, and I'm not sure whether or not DOA is going to be able to do this, would be to have the funding available within the next 45 days after it's voted upon, so that the funds are available much sooner and we can get started much sooner.
So you feel that this legislation here will not stop you from actually using the funding for, or kind of switching things around, instead of finding out that you only need 2.9 million for the medical equipment, suite, med-surg beds, that there's some savings there, that you can actually use that toward, like, let's say the MRI, that comes up. So do you feel that you're able to make those adjustments within this legislation?
So, Senator, thank you for that question. We can respond with, we thought we would have it satisfied enough when Section 3 was added for an authorization to reprogram funds. But at today's start of the Committee of the Whole, we did ask for consideration of the body to give us a little bit more flexibility. So yes, in fact, we were requesting for another amendment.
Have you worked with the Oversight Chair to look at that kind of amendment that's going to be needed to provide her the language?
Yes, Senator.
Okay. So, okay, then that was one of my concerns, on that. Because, of course, my bill gave you that full flexibility, just giving you the funding to address the capital improvements that are needed. So I'm glad, well, I hope the...
But Senator,
Yeah.
there is another opportunity that Dr. Arkin just described. If you wanted to furnish an amendment that would request DOA or inform DOA to transfer that money within 45 days upon enactment of this bill. We didn't talk to DOA, but...
Okay, well, I'm going to yield to the author of the legislation, for any kind of amendments, moving forward with regards to that, and so I'll just allow her to work on that. Okay, if I can't
Thank you,
get-
Senator.
yeah.
We are working on it.
Okay, so knowing that it's already in motion, I'm going to support that motion, to move forward on something like that. But, again, it's important to know that not just this body, but the prior legislatures, even when I got in the 35th Guam Legislature, we've been fighting tooth and nail for the hospital and the importance of addressing it now. I know our good speaker right now has been talking about we need to fix the hospital today, and that's what needs to happen. So I'm glad to see that you are trying to do that, but again, it takes a village, and you need to work with all senators here to make that happen. And when you come up for budget, I really appreciate this year when you came up to budget, you came up with a true amount and stuck to your guns on it. Because in the past, last 4 that I know of budget, you came in with only 23 million. 23 million, that was it. But you knew you needed more, like 60. But you were told to stay in your lane at 23. That's not going to work. So I hope that this set of administrators at Guam Memorial Hospital is going to do what's good for Guam Memorial Hospital and not make it political. Similar to what, unfortunately this bill has done. So I thank you again and looking forward to working with you on some other issues that you have at the hospital. And I'm sure some other senators will continue to maintain that same advocacy for you and question any concerns you have. My very last question is the RMC that we're talking about, our RCM. What is the contract for that? How long is that contract?
Right now, Senator, we have it for a year.
1 year?
1 year.
Okay. And what is one of the main goals of that contract?
It's to improve GMH's collections. I mean, that's really the bottom line. But in order to get there, we need to improve our coding accuracy. We need to reduce our denials. We need faster claim submission. We need modern analytics. We need charge master corrections. We need it all.
Okay, who's actually the owner of that contract? What's the name? I mean, it's
Oh, there's an RFP out, and it will close on December 15th.
an RP. Okay, so
Yes,
and
ma'am.
procurement purposes you can't say at this point, right? Or has
We
it already been
actually
awarded?
don't know. There's about 31 packets that have been picked
Okay,
up.
so it has not been awarded yet
Correct.
at this point.
Correct.
Okay, well, I'm taking procurement classes, so I know you can't say anything about it. So I'm not going to ask you, and I wish you good luck on that too as well.
Thank you, Senator.
Okay, thank you so much.
Vice Speaker Ada,
Thank you, Mr.
on this
Chair.
non-political 187.
Thank you, Mr. Chair.
Point
And
of
I'd like to-
information,
to
Mr.
get the,
Chair. Point of information.
No need for a point of information.
Oh,
Vice Speaker
is there
Ada,
not? You're
recognized.
being a little bit, out of order here too, Mr. Chair.
I have the floor and I'm not out
Yeah.
of order. Vice
Yeah.
Speaker Ada, you are recognized.
Thank you, Mr. Chair. Thank you to the panel for being here, and hope this Christmas and New Year is great for all of you and your families. Perhaps maybe just a couple of questions that I have on the, I know yesterday Ms. Hechanova was mentioning about, I think there's still about maybe $5 million that are still outstanding to vendor payables, or is that correct?
5 million, that's correct.
Do you plan to use any of this money to pay off those vendors, or
No,
none?
no. This money is used for what's listed here, Senator, the CIP.
I see. And do you see I wish we weren't here today discussing about CIP projects, because we have money there, federal money, for CIP projects, right, a couple of years ago. And with so much federal funding that came into this island, that could have taken care of a lot of these issues that are plaguing the hospital today that were not taken care of in the past, and now we're utilizing our own resources to pay now for what could have been paid for previously. But that being said, has the administration gone back to GORA to revisit again the Community Development Block Grant disaster relief funding? You're shaking your head. You want to respond on that?
Good morning, sir. For whatever grants out there or any opportunity to get some finance assistance, we're looking for all those, and we'll try to get them.
Yeah, but I understand that you guys reached out to them previously, and they came back and said that, what was their response?
Yes, so regarding the CDBG-DR, my understanding is we're actually going to we're actually meeting to kind of discuss what are the potential projects that we can now start to put in. I believe they kind of moved on their phase. Our planning team is the one that's been really following this, and so we're going to meet internally to kind of discuss more so what would be the projects that we would potentially qualify that we can put through the CDBG-DR.
Yeah, because I believe they set aside 60 million, right, for the new hospital project that was supposedly supposed to happen.
In addition, my understanding is yes. If I read it correctly, there was $60 million for the A&E for the new hospital. But in addition to that, there's a different set-aside amount for the community infrastructure, and then for disaster recovery also. So we're looking into those pots of money as well.
Okay, and when was the last time you communicated with GURA?
My understanding is our team went down to the public outreach that they had recently. I forget the date, but our team was down there.
Who in your team reached out to them specifically?
Paula Terlahi, Paula Palayo. She is our chief hospital planner.
And who did she communicate with at GURA?
I can get back to you on that specific.
Yeah, if you can, and find out what the conversation is between her and GURA, so that we can find out where we're at in getting some of those federal funding for the hospital.
Yes, Senator.
And ensuring that, you guys will be able to get some of that pot that is, over $300 million that's available I'm sure they can afford to give GMH some type of,
Will do.
all right? And then I see the capital improvement projects, and I heard about the HVAC system, the chillers. What paid the chillers that just arrived and that you guys are installing? What was used to pay those?
So for our chillers, the two 450-ton chillers and the two cooling towers, as well as the 265-ton chiller and the air-cooled condensing units have all arrived. They're all on island. We currently have one of the cooling towers already installed. JWS, who's the contractor for this, is on site actively working on this project. As far as payment, we use part of the $40 million supplemental that we received to pay part of the invoices, as well as the $20 million supplemental funds that we received a few years back. And then our fiscal year 26, our current appropriation allotment, sorry.
Okay. And I see that that was spoken about was the MRI building demolition, and is that still a priority project for GMH? I mean, that's 300,000 that could be utilized somewhere else, right?
Senator, you know, it's lower on the priority list.
Yeah, so it's no longer on the priority list.
It's on the priority list, just lower on the priority list. Everything that's listed here is top priority.
I see. Okay, well, you know, hope this, you know, this bill gets passed and we go through and, you know, things are looking up now at GMH and hopefully be able to. The only thing I didn't see here was painting. You guys plan to paint the hospital?
We're going to paint hopefully in the next week. In the next week, we need to do they're mobilizing. We want to water blast first. We're going to water blast tomorrow, Senator. And then they can start working on the painting.
That's good. Good to hear. Hopefully all the leaks get plugged up and be able to utilize the linen for what it's intent for, and you know, not for mopping up the floors. So, but other than that, thank you, Mr. Chair.
Si Diyos Masi, Vice Speaker Ada. Ranking Member Tina Rose Munya Barnes.
Si Diyos Masi, Mr. Chair, and Manana Situas to you and to the panel up there. Thank you very much for being here for the last couple of days. I want to say thank you, and as the retiring speakers spoke about the need, what we can leverage. I'm always looking at leveraging. What can we work with the other partners out there and other agencies that can help improve the services that our hospital provides to all the patients that go through that door, because again, our public hospital cannot reject any patient that walks through those doors. I am want to thank the author and the co-sponsors of this legislation, and hoping I can get tapped into being a part of the co-sponsorship also. But as I look at the $745,714, right? 19,745,714. And I look at the breakdowns, the 5.1 million for structural and agriculture projects, the MIS server room upgrades, the demolition retrofits on the Z wing, the maternal child care renovation and expansion project that I asked about yesterday, the hospital center island parking, the 7.3 million for the utility systems project. I know we spoke about the chillers just a second ago, but this is the additional chillers needed, right, for the hospital, right? Go ahead.
So with the chillers, I just want to clarify because if you recall, this is part of our, we originally had funded this under, well, we were originally procuring this under ARPA funds. And again, this is something urgently needed. And of course, as a result of Typhoon Mawar, our chillers were actually further compromised. And so we really needed this project to go through. And so when the ARPA funding didn't come through, of course, we have to look at other funding sources, and hence that's why I was explaining earlier, there was broken down into different funding. The remaining portion of our chillers project, while we initially had pledged our collections, and as we know, our collections unfortunately is unpredictable, and hence the reason why we still need the remaining amounts to be funded through the CIP funding.
Appreciate that answer. And as I go on further, right, because there's that need that still needs to be there based on the resources that wasn't given previously. You also have the 1.055833 for the alternate care site projects. We also have 3.95 million plus for the medical equipment, for the angiographic suite, the med-surg beds, the ventilators, the BPAP repair parts, the bio safety hoods. And I'm listing this because I want the public to know what the delineation is here. The patient cardiac monitoring project plus the HER interface and anesthesia machines, the $2,704,240 for the information technology project, and $156,986 for the medical transport. I did want to say on that medical transport, do you guys have a present contract today with anybody out there? With any private vendor?
For the medical transport, we do have, I believe, 2 units that our patient couriers and team use. And then depending on the situation, I think there is a private contractor that is utilized on an as-needed basis if our vehicle is down and things like that.
Okay, so based on the $19.745 million that's going to be delineated for all these projects are in here, are we sure that none of this funding source, when appropriated or when provided to the hospital, will not be used for personnel or hiring?
Yes, Senator. Our understanding of this bill is that we will only use it for our critical projects.
Wanted to make sure, I know it's in section B of the proposal of this bill, but I wanted to make sure that it's reiterated that none of these resources that will be provided to the hospital be utilized for that. I also want to say that in the efforts of looking what the hospital can do with the resources it gets, is looking at the future and what the hospital does to make extra money, because as an autonomous agency, or right now it's semi-autonomous because you're still coming back to this body to ask for funds, because what you receive in medical payments and all that is never enough. And like I said, until we can find that dedicated funding source just for the hospital, it's never going to be enough, because there are a lot of patients that walk through that don't even have the means to pay. And as we look at the insurance companies and everybody else on the collection side, how much effort has been done to improve those collections today? Looking at you, Dr. Huggin, if maybe you can reiterate so that the listening audience can hear.
Yeah,
I mean, I know we worked on garnishments in the past, but what other ways can we help to get those?
Yeah, no, I think that we are taking a very centered approach on this. We're upgrading our systems so that we can reduce our overtime. We can reduce all of the manpower, the manual manpower it takes to carry out a lot of the processes in the hospital. Keeping track of our inventory and decreasing waste, because we do waste. We're buying things and not using it before the expiration date and having to get rid of it. And so we're trying to reduce that by implementing an inventory system that keeps track of these particular details and drops charges as we use the supplies or whatever the consumables are. We're also outsourcing the full revenue cycle management because we absolutely lack capacity. And when I say we absolutely lack capacity, we don't have the specialty coders for inpatient. We don't have enough. We have a system that doesn't do that for us automatically either. Neither does it communicate with our registration. We're using a legacy system on top of the system that we purchased in 2023 or went live. There's just a lot of inefficiency, Senator, that we're trying to fix by upgrading our software so that we can be more efficient and more cost effective. And with the billings and collections, as we wait for the RCM, we can see that we are behind on some of our billing. And so we are looking into small purchase to assist us right now until such time the RCM is completed and to work on our denials. So there are key performance indicators that all hospitals nationally should be reaching, and we are not reaching those goals. In the 2024 audit, it showed that, we were losing a lot of money. There's a lot of money on the table, and we are trying to close that gap.
I think with the collaboration that you're doing and working with the employees and having the morale come right back up to where it should be, and just looking at the indicators that are needed for improvement, I think if you continue to bring the awareness out to the community, and it's like a report card, right, or an assessment. I don't like to say book reports because I know that we've been asking a lot for that, but I think if the awareness can continue to come out, and what you have delineated today, and what the indicators to make things better, I think if the awareness goes out into the community, there will be a lot of less heartache and a lot of more trust that's coming back to what our only public hospital's done. I'm not ashamed to say that I grew up in the hospital. My mother was there for 40 years after she retired and was the chairman of the board. She literally gave her life and love to the care and the upkeep and even the pastoral care of the hospital, and something that a lot of our people continue to watch and care for. And I think that if this awareness of bringing the community together and working on making sure that the indicators that you talked about and the updates that you need to do, I think it would be a lot less stressful for not just you as management, but also for the staff and the community. And before I close, I know I have 3 minutes left, but I wanted to ask your collaboration with the tri-support of the Naval Hospital, GRMC, and yourselves. How has that tri-collaboration been working for GMH today? Or is there any still?
No, we work closely with GRMC. We should be meeting with GRMC soon. I'm hoping to set up a meeting because they are offering Guam Memorial Hospital the possibility of group sharing or group purchasing. And that's another cost savings that we're looking at. We We are working closely with Department of Administration on our pharmaceuticals as well. Um, as far as Navy is concerned, we're always here to support the Naval Hospital. You know, it's difficult for Navy to receive our patients if they are not card holders. But they've always been, you know, helpful with supplies or any equipment that we need, and they do that daily, even medications. All three hospitals work together when we need help.
It's good to hear. And one last point, Mr. Chair, if I may, because you brought it up, and as far as like medications and supplies and expired stuff that you pay for and then end up not using. And I think what has come to my attention in the past, working with the Public Policy Institute here in the legislature, the students brought up the fact that with the hospital, sometimes the lowest price as it relates to RPs going out is not the best way to get those kinds of equipments and supplies and medication. But maybe what we could do is revisit what's comparable and what's the best and ideal instead of the lowest price, which is usually the case through procurement right now. Am I saying that correctly? Would you like to pontificate or say anything on that? And
No,
as far
that's
as the
correct.
justification?
That is correct.
Okay, so in that effort, Mr. Chair, thank you very much for giving me the time to say my comments and ask a couple of questions. But more importantly, as we move forward, we want to show the community that this August body really wants to work closely with the hospital and help give the resources that they need, and working closely with the oversight chair, who's literally done a lot to help in the advocation of what the hospital needs to do. And maybe even, like I said, bringing the awareness out. I want to say that this is the right thing to do. So in that effort, I'm just, my appreciation is out there, and wishing all of you guys a blessed Merry Christmas, and may the new year for 2026 become much better for all our hospitals. Sina Masi.
Cedus Masi, Ranking Member, Senator Tina Ruania Barnes. Senators, that completes round one and all the questions. I want to thank GMH team for coming down and enduring this last couple of days, and want to wish you and all of your team a very Merry Christmas and a Happy New Year. Hopefully this will be it for the year that you have to come down and justify things. So thank you very much.
Thank you, Senator.
Thank you.
Thank you, everyone. Happy holidays.
And also to the Director of Department of Administration, thank you and the team and all of the fiscal team for all the hard work that you've done as well, and have a Merry Christmas. We'll take a short recess and go into the amendment portion and round two. We are in recess. The Committee of the Whole is back in order. Colleagues, we are in the second round for comments and amendments. We will dispose of the amendments first. There are two amendments that made it into the drive prior to the close of round one. So we'll start with the first one. Colleagues, this amendment is AB 187L14P4SSM, and it's proffered by Senator Sabrina Salas Montanani. Senator, you're recognized.
Thank you, Mr. Chair. My amendment is to add a new section to the bill to read Section 4, Authorization for Additional Critical Capital Improvement Projects. It states that notwithstanding any provision of law, the funds appropriated or authorized by this act for capital improvement projects may be expended for any other critical capital improvement projects not specifically enumerated in this act, provided that the total expenditure for such unlisted project, in combination with all other expenditures authorized by this act, does not exceed the aggregate amount appropriated or authorized herein. And again, this amendment was introduced based on the request from the Guam Memorial Hospital.
Thank you, Senator. On the amendment, does anybody like to speak on the amendment? On the amendment, Senator Talatadegui, you recognize.
Thank you, Mr. Chair. I stand in full support of this amendment. I think it reflects the same bill that I introduced after this one to allow that flexibility, and appreciate that the senator, the author of the main bill, incorporated this as I asked that question during our first round. And I'm pretty sure that, Mr. Chair, it's going to be difficult to determine the cost, down to the dollar amount on what projects cost, because you go through procurement, you go through bids, and it could be different. And if there's any leftover funding, that could go to other projects, and we want to allow that flexibility to happen as well as finding out that maybe costs are more expensive in a certain area that was identified in this bill and needs more funding. So moving funding from one to another project. However, the projects, Mr. Chair, in this bill itself, the bill itself, is very important and is recognized. So, the intention is to try and not only just recognize it, but make sure that it's actually addressed. So, again, I stand in support of this amendment. Thank you.
Any other member wish to speak on the amendment? On the amendment, any other member wish to speak? Senator Chalai, you recognize.
Yeah, I support this amendment as well. It's to allow GMH to use the money we're going to give them in this bill, that's actual money from actual savings on refinancing the bond, for additional capital improvement projects than those that they've listed. I just hope, though, that GMH will be able to be very, very clear with us. They seem a little resistant this morning to tell us exactly which projects are priority, which ones are going to do first, which would of course, they have a lot of priority projects. They've had that since 2019. But when they come in here on oversight hearings, for appropriation bills, during budget hearings, their lists seem to change. And I think it's very reasonable for the people of Guam to expect an explanation or justification. How did the parking lot become more important than the fire panel changes, the electrical panel? Or how did the elevator project, why is that still on this list after all the money that they've received when that project's been in line for so long? Just like the HVACs, just things like that. We want them to do these projects, but we also want them to be able to justify for the people of Guam all the money that they've received and why these priority listings change. The listing that they've given us today, or that is now in this bill, again, is different than the listing from the original bill. They're all lumped together. They're not prioritized. So it just hinders, I think, the people of Guam from holding GMH accountable for all this money that we've been giving them. In addition to regular budgets, we've given them $40 million for capital improvement projects just in the last fiscal year. Prior to that, in addition to the regular budget, they were given $30 million for vendor payables because they did not pay their vendors. And we, in prior budgets, did the same, gave them regular budgets and then came in and tried to give them capital improvement money that they refused to ask for at the time. So giving them this, giving it for additional critical capital improvement projects, I understand these priorities might change, but I just think with all the history of GMH over all these years, we're trying to improve it supposedly for the next 5 years. That's what the Army Corps told us to do, make improvements at that time for 5 years because that hospital needed to be operable for 5 more years while the new hospital's being built. So I just want GMH to be able to explain the capital improvement projects that are life-saving and those that are not. And the ones, this list frankly does not match the one that was given by the Army Corps with the ones that they said were priority. Some of them are still here. They're not done in the last 5 years, but there are additional projects. So again, I just want to make sure we're all in the same place here where we are shoring up this hospital for the next 5 years. Unfortunately, we have to rebuild the whole maternal child health because that was critical even in 2010. And that's why it was funded years ago. But they're only beginning this project now, or they haven't begun it yet. They said today they're still waiting for the final solicitation to be closed. So they can't tell us even whether they're going to exceed budget like they did last time or not. So we'll see. But in any way, as to the amendment, yes, allow them to do critical capital improvement projects. That's consistent with what we've always asked them to do, critical ones. And so I hope that they will give us an accounting of which ones they've decided to use these funds for, when can we expect completion, and which ones on this list we are not going to be able to do because of limitations of funding or procurement or otherwise. I know, well, that's all I'm going to say on this amendment. I support the amendment.
On the amendment, anyone else wish to speak on the amendment? Senator Barnett, you recognize.
Mr. Chair. I too rise in support of the amendment because it pretty much does what the bill that Senator Taitigui and I introduced that for whatever reason you chose not to move forward in your committee, Mr. Chair. But it does allow the flexibility that the Guam Memorial Hospital has stated on the record that they need with this funding to be able to move it from project to project, even if those projects aren't specifically listed in the act. And as we heard from the Guam Memorial Hospital, I believe the list of projects is exhaustive. So stand in support of the amendment, Mr. Chair. Sidus Masi.
Senator, for the record, your bill was redundant. This bill was before your bill. On the amendment,
Well,
anybody
just
wish to speak on the amendment?
point of information, Mr. Chair.
What's
The
your point
bill
of
wasn't
information?
redundant
Point of
because
order,
we
Mr.
actually
Chair.
had the, we had the correct.
That's
order,
not
Mr.
a
Chair.
point of information. On the amendment,
Point of order,
There you
Mr.
are.
Chair.
Thank you,
you're
Mr. Chair.
recognized, Senator.
Thank you, Mr.
Gumentado.
Chair. Just
Point of information, Mr. Chair.
I am entertaining a point of information by Mr. Gumentado. Senator, I am entertaining a point of information by Mr. Gumentado at this time. Senator, proceed.
Thank you, Mr. Chair. Chapter 10, debate on proposals in a Mason's Manual, Section 101. Debate is limited to proposal before the House. Number 4, debate on a bill is confined to the bill under consideration and does not extend to criticism of other bills before the House or in committee, even though they relate to the same subject. Thank you, Mr. Chair, for that.
Thank you for that point of information, Senator Gumentado. Senator Taitigui, you recognize.
Well, I just want to make sure, Mr. Chair, as the oversight chair in conducting this hearing, that you do it fairly. Thank you.
That's not a point of information. On the amendment.
Well, it's obvious a point of information or not.
On the amendment. Anybody wish to speak on the amendment, which is in order? Thank you. Ranking member, you're recognized.
Thank you, Mr. Chair. Just to support on the record that This amendment as proffered by the Code Oversight Chair to authorize the funds could be expended for any other critical capital improvement not enumerated here, provided that the expenditure of such unlisted project in combination with all other expenditures are authorized in this act. I think that this is a very good amendment, and I'm hoping that my colleagues look at this amendment and support its efforts. Senator Massey.
Cedus Massey, Ranking Member. On the amendment, anybody else wish to speak on the amendment? Seeing and hearing none, Senator Montanani, you're recognized to close.
I don't have a closing other than thank you.
On the amendment as proffered, are there any objections on the amendment? Seeing and hearing none, amendment passes. Senators, the next amendment that was submitted to the drive is AB 187L8-9P4 TMT. This appropriation covers any previous unremitted GMH Pharmaceutical Fund amounts and clears any obligation to GMH Pharmaceutical Funds prior to fiscal year 2026. I'm going to rule this amendment out of order.
On what basis, Mr. Chair?
On the basis that this is not about retiring any funds prior year. This bill is an appropriation bill for GMH for their critical CIP projects, and so this is out of order. Senators, we have exhausted all the amendments in the drive.
Point of information.
Yes.
You know, I'm going to have to rule you out of, actually rule against your calling of being inhumane. The same scenario happened in the previous bill in 186, where you ruled my quarter reporting out of order when this particular bill has a reporting requirement on this bill. So what is not germane about it, I don't understand.
It's non-debatable. Are you moving to overrule the chair?
Yes, I am. I am.
There's a motion to overrule the chair that this amendment is out of order. All in favor to overrule the chair, please indicate by raising your hand. Motion fails. Senators, we have completed the amendment portion and we are now in the comment period. Does anyone wish to comment on the bill? Senator Tadigue, you recognize.
Mr. Speaker, I rise in full support of getting this desperately needed funding to GMH, but also fully committed to telling the truth about what happened. And regardless of what the Mason's rule says, you can't mention the exact bill number of something, but you can mention the intentions that I intended to do for another bill that I proffered. And that bill had a public hearing just like this bill. My bill had the right amount to it. My intention was to put the time in, to do the research, and get the right amount in. But if you ask me, the way this has been handled has been an injustice, and it's also lost the trust in our people about the way we conduct business in this body. It's the kind of maneuvering, that kind of bull that makes the people of Guam lose the trust in government. When we evaluate an inaccurate bill and bury the current one that obviously is the correct one. But let me be clear. This is not about credit. This is about credibility, which our people not only expect, but deserve.
Point of personal privilege, Mr.
We
Chair.
believe
Point of personal privilege.
What is your point of personal
Wait,
privilege?
and it
Senator?
better be,
I'm recognizing the senator
Mr.
on
Speaker,
point of
Mr.
personal
Chair,
privilege.
the point of personal privilege is if there was somebody that was
privilege.
intended bad.
Senator
I did not
Tadigue,
say anything
I am
bad about a
recognizing the
senator.
senator on her point
I
of
never
personal privilege.
mentioned a senator's name, so
Senator,
Mr.
as the
Chair,
I am the current author of
make
this
sure.
bill, and you've been
I am making
insinuating
sure I
and
am
attacking
doing my
my
job as the
credibility
chair.
and my
Please
integrity.
Please proceed with your point of personal
That's
privilege.
my personal
Senator.
point of personal privilege.
Please repeat
that
it
her
because you are
comments-
being talked over. Thank you.
My point of personal privilege is that I do not appreciate the speaker, current speaker, attacking, I feel, my integrity and my credibility.
Thank you. You may proceed, Senator Titleguy.
And Mr. Chair, if you can correct actually what appointed personal privilege is, you will see that appointed personal privilege is if somebody is being directly attacked. I'm not directly attacking an individual pointing a person out. I'm talking about the process in this body and how it's moved. So let's make that clear. If someone feels bad about something, well, then maybe it's just guilt.
I don't feel guilty about anything.
But other than
I think
that,
it's clear who you are
this bill-
attacking.
No,
not just myself, but the chair.
Oh, but you have no right, Senator. You're coming out as appointed privilege, personal privilege for yourself. No one else but yourself.
I think it's clear who you're attacking. You're attacking the chair,
No,
and I'm just
You should
saying
ask Senator
how I feel
Gumatauta to
that
read
you're
the Mason's
attacking
manual. It
my
will clearly tell you
credibility and
how
my
to
integrity,
respond to
something that
appointed
you have
personal
been doing
privilege.
to other senators.
Mr. Chair, if I may,
Please continue.
the
so we can
Mason's
continue
manual,
on.
I asked my good colleague, to look at the Mason's manual, and, sure, Senator Gumatauta has it on hand about what a personal privilege is about and how to call it out. So once again, let me be clear, this is not about credit. It's about a credibility which our people not only expect, but deserve. And believe you me, they're watching to see who actually supports this kind of shenanigans. Now, that being said, GMH needs this funding, and it needs it yesterday. The testimony was compelling. The infrastructure failures are real. The risks to patient safety are real. And I'm relieved that the amendment version of 187 now reflects a correct amount and allows the flexibility. That's what I put forward, and I'm glad that it's being done today, regardless who did it or not. It was the process, Mr. Chair. So I support getting GMH the fund it desperately needs. I've always been an advocate for GMH. But the way we arrived here cannot be ignored. The people of Guam deserve honesty both in numbers and the way we conduct their business. Sijus Masi, Mr. Chair. Thank you for the opportunity.
Thank you, Senator Titleguy. Chairman Duenas, you're recognized.
Sijus Masi, Mr. Chair. I rise to say that I'm appalled at the conduct of a certain member that continues to impugn the integrity of the Committee on Finance and
Point
Operations.
of personal privilege now, Mr. Chair, and if you look at the I have a point of personal privilege.
I have not addressed
a point
any
of personal
individual. I have
privilege.
talked about the process, Mr. Chairman.
No, that was not the process. It was intentionally, and if you look at the Mason's manual and you read what he just said, he is directing that at me, and I thought we're not supposed
Mr.
to
Chairman,
talk. I'm talking about the process.
about the process
Colleagues.
and the impugning of integrity of the process. That has been brought up, and I have every right to address it, Mr. Chair. Mr. Chair, the integrity of the Committee on Finance and Government Operations is being called into question here, and I resent that. I resent that, and I resent that aspersion to every member of the committee, of which you are the vice chair, Mr. Vice Speaker. And I also take very strong umbrage to the fact that we not only had a public hearing, we had a markup hearing, we had a Committee on Rules meeting, which fully approved the placement of Bill 18738 onto the agenda. Mr. Chair.
Point of information, Mr. Chair.
Mr. Chair,
Point of information.
A point of information.
My bill, 188, did not have a markup meeting. Thank you.
For all the discussion on it, doesn't matter who gets the credit. Boy, somebody just cannot stop and at all costs must impugn the integrity of a committee which did its proper work and found that another bill with the same subject matter was redundant and came after the original bill that was introduced, which is the design of this body to hear the legislation and to do the work in committee as necessary to mark up the bill, which rendered a bill that came afterwards redundant. Simple as that, Mr. Chairman. That is the procedure. In fact, in this legislature, Mr. Chair, in this 38th Guam Legislature, that is so refined compared to prior legislatures, where bills are marked up, committees mark up the bills, and do the work, and not put two bills on the floor and let everybody go at it.
Point of information,
Because
Mr.
they're
Chair.
redundant in process
The
and
bill had a
redundant
different
in terms
money
of their
amount.
title.
It's not redundant. It had a different money amount.
Mr. Chair.
Both bills were different in
Mr.
amount.
Chair, Mr. Chair, the very effective...
Point of order, Mr. Chair.
State your point of order.
I'll say it again, Chapter 24, Parliamentary Inquiries and Other Requests for Information. Section 253, Requests for Information from Members. Number 5, the presiding officer should never permit a speaker to be heckled by questions, nor permit a member to present arguments under the guise of questions. A member should not be permitted to interrupt a speaker to ask questions of other members unless some urgent reason exists. Thank you, Mr. Chair.
Thank you for your point of order. Continue, Mr. Chairman Duenas.
Mr. Chair, once again, the very effective and proper process of carrying forward committee work on statutes and bills that are introduced in this august body was fervently followed by our committee, was done properly, professionally, and effectively. The bill before us reflects a markup to include all testimony that was in the public hearing and even was cleared by BBMR, and you now have as part of the record the letter from Department of Administration clearing this bill as proper, as properly marked up, and you had the Director of Department of Administration here stating clearly, not saying anything about any other legislation, stating clearly, this is the bill that they support. This bill has the correct verbiage. This bill has the correct amount. And this even, they take the pains to recognize the committee's work. At least we have the Department of Administration that's willing to put it and sign to it and attested by BBMR that this was done duly and rightly and correctly implemented, and they fully support this bill. I don't know how much more we can advance the integrity of Office and Finance and Budget and Government Operations than to get the full endorsement from the Department of Administration and BBMR. Once again, I will not allow the good members of my committee's integrity to be impugned. I resent it, and I support this bill as marked up by the great Committee of Office and Finance and Budget. Jesus Masi, Mr. Chair.
Thank you, Chairman Duenas. Any other member wish to speak on the... There being none. Senator Terlahi.
Thank you. On the bill, this bill is going to give $19, almost $20 million in savings from a refunded bond to GMH. So that was not slated to go anywhere after the bond was refinanced, and this bill puts it there. So this is going to be a very solid funding source. We've confirmed with DOA and BBMR that this funding source exists. Gita, who did the refunding, explained in their testimony on another bill that this funding source is solid and this is the correct amount. In comparison to the previous bill, where the public auditor, the Department of Administration, and BBMR all agreed that there was no such funding, and the appropriation given to GMH in previous years far exceeded what GMH is claiming to be owed by the people of Guam. This bill is giving the discussion on the floor amendment that would have made clear that taxpayers continue to give GMH funds and does not owe GMH anything was refused by the chair. And I think that that's too bad that discussion is really curtailed in this session hall on very valid points. For example, GMH continues to change what their goals are, what they're doing, and we get very limited time to question them. Yet, they said they would cut, they did a reso that said they were going to cut 10 million. Today, they're in employees. Now they're saying, and they sent out notices to their employees. Now they're saying that's not a path they want to follow. And they're hoping to gain more revenue by outsourcing revenue claims management instead. And this revenue claims management contract, when they told us what it aims to do, is pretty much, according to the audit by the public auditor, what the last RCM contract was supposed to have already done. That audit said that GMH only collected 47% to 48% of gross patient revenues during the contract period, compared with 58 to 59% collected during the years prior to the contract. The financial audit disclosed recurring issues relating to hospitals' continued incurrence of losses from operations and negative cash flows, and increases in unbilled patient receivables. But GMH in the audit also said their response was to the auditor was that the contractor assisted with the implementation of Bill Scrubber and clearinghouse software, and a revenue integrity department, an entire department was established to maintain exactly what this new contract wants to do: charge description master, ensure charge capture, prevent coding errors, investigate revenue loss and leakage. GMH also revamped at that time billing workflows, developing critical reports to monitor daily, better coding workflows implemented, better organizational structure in the patient affairs department. They received training throughout the departments throughout the contract period, which involved billers, coders, follow-up, revenue integrity, patient registration, and the relevant department supervisors. They began managing its revenue cycle process under a new revenue cycle director after the contract's termination in November 2022. So again, I think it's valid to question GMH as to these repeated, like, back and forth. We're going to do it in-house, now we're going to do it out-house. We're going to cut expenditures, now we're not. We're going to just increase revenue instead. And we needed to fix the elevators and the HVAC and the electrical panel years ago, but they did other things. Like, we have a contract now for a PR firm. I understand that's the former chief of staff of the governor. We did a breaking ground on a parking lot after we had a fire, while we have a maternal child health still waiting after years of appropriations sitting. These things, I mean, they come in with inconsistent answers, and all I ask is that they continue to be transparent and consistent as much as possible for the next 5 years. Thank you.
Point of information, Mr. Chair.
State your point of information.
Thank you, Mr. Chair. Mr. Chair, section 92, page 73, on the Masons Manual clearly states members who are speaking may be interrupted for the following purposes. One is a point of personal privilege. A, B, C, D, then a member does not require recognition from the presiding judge for the purposes. But on section 4, when a member is speaking and another member interrupts to request recognition, is the right of the presiding officer to permit the one rising to the state of reason for desiring of the floor. Thank you, Mr. Chair.
Thank you, Senator. I will remind the body that every decision made by the chair has
That's
been
out of
the
order,
will
Mr.
of the
Chair.
body. I will remind the body
Out of order, Mr.
that
Chair. Are you making a ruling on some
I will
motion?
remind the body that every motion that has been made
out of
and
order.
every
Point of order,
decision
Mr.
from
Chair.
the chair has been affirmed by the will of the body. Would anyone else like to speak on the bill that has not spoken on the bill? Seeing and hearing none, we'll take a short recess. Committee of the Whole is back in order. Senator Salas Montanani, you're recognized.
Thank you, Mr. Chair. I move that Bill number 18738 COR as amended by the Committee on Finance and Government Operations, an act to appropriate the sum of $19,745,714 from the general fund realized from bond refunding savings not factored into the fiscal year 2026 budget for capital improvement projects and life-saving supplies and materials at the Guam Memorial Hospital Authority, with the recommendation of the Committee of the Whole to be placed on the third reading file, as amended on the floor.
And further amended on the floor, correct. On that motion, are there any objections? No objections, so ordered. Vice Speaker Atta, you're recognized.
Thank you, Mr. Chair. And Mr. Chair, I move to rise from the Committee of the Whole with the recommendation that Bill number 186-38 COR and 187-38 COR as amended and further amended on the floor be placed in the third reading file.
On that motion, are there objections? Seeing and hearing none, so ordered. We are in recess and we are risen from the Committee of the Whole.
Immune 38 na legislature is back in order. Senator Salas Matsanani, you're recognized.
Thank you so much, Mr. Speaker. I wish to report back to the body after deliberations on bill numbers 18638 COR and 18738 COR as amended, the recommendation of the Committee of the Whole to place bill numbers 18638 COR and 18738 COR as amended on the third reading file.
Okay. On the motion to place bills 186-38 COR and 187-38 COR as amended to third reading file, are there any objections? Hearing and seeing no objection, motion carries. Senator Parrish, you're recognized, ma'am.
Thank you, Mr. Speaker. I move to reconsider the actions of the body on my amendment for Bill 165-38 as amended. I wanted to withdraw my amendment.
So it's to reconsider the action of the body bill 165-38 relative to your amendment.
Correct.
All right. On that motion, no objections, so ordered. Senator Parrish, you recognize, ma'am.
Thank you, Mr. Speaker. I wish to withdraw my amendment at this time. I would like to work with the sponsor of the bill. It was placed in the wrong section of the bill, and I just wanted to get, I guess, have more time to work with the sponsor.
You wanted to reconsider the actions of the body on the amendment?
Yes, and to withdraw it.
Okay, so let's reconsider first. We have to reconsider the actions of the body. She had put the amendment onto the bill that provided the language in person or electronically. It is found to be that it doesn't fit where it's supposed to be going in. So in order not to confuse the bill, she's going to take that portion out, the amendment out.
Yeah, Mr. Speaker, do we need to bring the bill back to second reading?
It is back in. We did reconsider. So
Okay.
it's back here.
So that brought it back, okay.
It already did. Okay? So now we're going to need to reconsider the amendment to that. All right? So on that motion, General Lady from Zone, you recognize?
Thank you. I would amend that motion if the body is willing to just allow legal to put that floor amendment language into the correct section. I understand it was just placed into the wrong subsection. If that...
Just take a moment's recess so they can clarify. Back from recess, ma'am.
I will withdraw my motion on consultation with the clerk who has consulted with council. Thank you.
Thank you very much. Thank you. Okay. On the motion, Senator Parrish.
Yes, thank you, Mr. Speaker. So notwithstanding the House rule, I move to withdraw my amendment to Bill 165-38.
On the motion to withdraw the amendment that places in the language in person or electronically on line 20 of page 2. Okay, are there any objections? Hearing and seeing no objection, motion carries. Senator Parrish, you are still recognized.
Thank you, Mr. Speaker. Mr. Speaker, I move to place Bill 165-38 COR as amended and further amended on the floor to the third reading file, and I ask that it return to its previous place.
On the motion, are there any objections? Hearing and seeing no objection, motion carries. Okay, we're done, right? Okay, colleagues, we've exhausted the items that we have in our second reading, albeit one, but based on our standing rules, that will remain on the calendar on second reading until the author or the main sponsor is able to present it on the floor. So therefore, we've exhausted all of this. We're going to move to the third reading, but what we'll do is let's recess and come back here at 3:30. 3:30 for voting, a third reading, 3:30, all right? We're in recess.